If it wasn't for the people, there wouldn't be a Mercy General Hospital. You have the building, but until you put the people in it and have them do the work in a spiritual, committed way, you don't have Mercy General Hospital. There are a lot of things that make Mercy General special, and I would say the first one is the sisters.
The Sisters of Mercy were started back in Dublin in 1831 by a woman named Catherine Macaulay, who had dedicated her life and her inheritance and started the House of Mercy. A smaller group came up to Sacramento in 1857 and began various ministries and social services, caring for the orphans and the poor. The new hospital was built and it opened on February 11th, 1925.
I think it's this sense of duality. You see community hospitals that are a front door in a community. If you're sick or injured, you go there, and we serve that role. But we also are a major referral center. I think it's a real anchor point for people that healthcare has been in their community for that long, and that it's progressed over time. I mean, we have equipment here that's new this year. We're still here, and we still care, and we do it passionately. But we also are advancing and crafting our work to keep up with the times.
Mercy General Hospital has had an amazing reputation in cardiovascular services for a long, long time. Nationally, when we think about the Cardiovascular Center, I think it represents excellence. People come from all over to get their cardiovascular services here at Mercy General Hospital. Not only does it attract patients, but it also attracts physicians. So people want to work with the best, and that's what we have here in cardiovascular services at Mercy General Hospital.
This place is very special to me. I've spent over 40 years here. Technology is mandatory. If you don't have the technology, you can't perform the task. However, we're here for the patient, not vice versa. That has to continue, and that's what's been true of Mercy through this 100 years.
The high-touch piece is so important to be able to connect individually with each and every patient. That is what they remember when they come to the hospital. The high touch is really what they walk away with, feeling like they were well cared for.
I'm very proud of the legacy and seeing my partners and colleagues and what amazing people they are and that have been brought on and have actually made this program what it is. This is really a tertiary care facility for cardiac care, and it's been the place where the sickest of the sick can come.
That sense of patient care, and I think the experience that the patients receive here, I can't help but think the seed of that are the Sisters of Mercy.
They have left a legacy of spirituality for this hospital, and the staff who are here support that spirituality.
I believe Mercy General has a bright future. I like to think that Mercy General Hospital will continue to be a beacon of hope way into the future.
The next 100 years, I would like to see Mercy not lose its feeling of togetherness, its feeling of spirituality, its feeling of everybody's on the same team and we're all working together regardless of your role. We're all working together for the same goal, and I would hope that would continue.
We can't project 100 years, but we're trying to project 10, 20, even 30 years. What sorts of services? How big will we need to be? How would we redesign it? And so I think that for the next 100 years, we're going to be here. And we may not look exactly the same, but we're going to be what the community needs us to be.